What a day. Please, isn't it now clear that we need to change the way that we're fighting this virus, especially in Victoria? What Victoria has been doing clearly does not work, not nearly as well. Today it set a terrible record. 723 new cases in a single day, and another grim record, 13 deaths in one day. And the whole country is now threatened. We've already seen people from Victoria, in fact, people in New South Wales, which is now trying to suppress its own mini wave, 18 new infections. And 2 women who went to an illegal party in Melbourne have now smuggled the virus in them through the quarantine border that Queensland has set up and into that state. And all that the Victorian Premier could offer today was more of the same that has failed. More shutdowns, more masks, exactly what hasn't worked. The government has extended the ban on home visits in Melbourne now to the city of Geelong. Its law that says Melburnians can't go outside without a face mask now applies to all country Victoria. Now I'm going to take some time tonight on what happened today, because it includes some very surprising, telling admissions from the Premier. Not that he quite knows it. I'm taking this time because this really is now a matter of life and death, and that includes yours. And because this way of fighting the virus is not working and will ruin us. And that's something every state leader has got to now consider, because what's happened in Victoria could happen to them. But let me start with today's figures to show you again where the real problem is. And once again, the 13 people today were all old. 6 in their 70s, 5 in their 80s, 2 in their 90s. I've just heard a few minutes before going on air there's a 14th death. I have got no details. Now, overwhelmingly, this is a virus that kills the very old and frail. I know it can kill the young. Governments keep telling us that, but don't be misled. So far, it has not killed a single Australian under the age of 40. Only 6 people under the age of 60. Most over 80. So it is the old we should most protect to keep down the dying, as I have said since April. Another thing, 10 of those 13 people to die were in aged care homes. And that's been the pattern in this Victorian wave. 2/3 of the dead were in these homes. So I'm afraid we have to expect perhaps even hundreds more deaths in Victoria, because our government's let this virus get into more than 80 aged care homes in that state, and more than 900 people from those homes are now sick. This has been a monumental disaster, mismanagement. But it's because these aged care homes were like killing fields. We saw it already in New South Wales, that our aim from the very start should above all have been this: keep the virus out of these homes. Number one priority. And stopping the old from dying there would have been so much easier, much cheaper, much less distressing than trying to stop the infection everywhere, which is what all governments have been trying to do. Now, I won't go again through all those shocking failures by the Victorian government and the Morrison government. Oh my God, how they failed. Aged care homes not shut off. Staff not stopped from moving between homes, spreading the infection. Poor testing, not enough protective equipment. Visitors and staff not told to mask up until just the other day. But let's assume that all these lessons have now been learned. The question is, what else now to do? What else is broken and should be fixed? And I think Premier Daniel Andrews' press conference today said so much about failure, and not just failure in Victoria. First, the failure to properly quarantine the sick. Again, something I've urged since April, not being wise after the event. That's too easy. Here is the Premier today talking about the army and health workers yesterday going to the doors of just 269 homes of the more than 5,500 Victorians it knows are infected. It knows should be at home in quarantine.
There were a number of people who were not home. There were also a number of other people who, when there was a discussion, the person that the ADF and the Health Department as a joint team were looking for, the person who has a confirmed diagnosis having coronavirus, they've got a positive test, they weren't home, but a family member was, and the family member helpfully pointed out that that person, a positive coronavirus case, was in fact at work.
Tested positive at work, probably infecting other people. Next week's figures should be interesting reading. But what about all the thousands of infected Victorians who weren't physically checked on yesterday? Where were they? Also at work? Shopping? Let me say it again. Taiwan, just 9 deaths there. Tracks your phone if you are sick. You leave quarantine, you leave your front gate. They know, they call. Why don't we do that? Or at least stick a policeman outside every door of every infected person if that's what it takes. Strict quarantine is the most important thing we can do to save ourselves. Yet in Victoria, we don't do the basics. In fact, the government lets people who are sick and supposed to be in quarantine go out for exercise if that's important to their health. Another admission of failure today. Here's the Premier talking about sick people quarantined at home.
On the other end of the spectrum, there were a number of people who needed scripts filled, a number of people who were running very low on some of the basic household items, everything from some groceries, toilet paper, things of that nature. We, because of that visit, we've been able to source all of those things for those people.
Again, what about the 5,000 or so other sick Victorians who weren't checked up on yesterday? Who got their prescriptions filled, their food and toilet paper bought? Did they have to go out, infected themselves, to get all this stuff? Once again, as I've said since April, we need a big new army of people, a super Meals on Wheels, to keep people who are sick or vulnerable, the elderly living in their own homes, safe in their homes. Do their shopping, run their errands, keep them entertained. And then there was this boast, an empty boast it turns out. Victoria has done more than 1 million tests. Victorians are the best.
It's very, very important, and it's impressive to think that we have one of the highest testing rates anywhere in the world. More than 1 in 5 Victorians have been tested.
Oh, that's brilliant, you know. Best at tests. One of the best in the world. So, excuse me, shouldn't you then be thinking, oh, so why is Victoria actually got the worst results in terms of deaths in Australia? We're the deadliest state by far. Well, here is a clue. It is the delay between getting yourself tested and then getting your results. It can take officially 1 to 3 days, sometimes longer, says the Department of Health, but I've heard of up to 9 days. And what do most people do while they're waiting for those results?
A bigger number are people that are between having the test taken and getting the results. They are still presenting to work.
Oh, so they go out. That's terrible enough. But let's go even one step further back. What is the point of these tests in the first place when the results take so long? Because as a study in the New England Journal of Medicine confirms, as I said earlier this week, when you get sick with this virus, your viral loads are in fact highest in the first couple of days. That's when you're at your most infectious. That's when you most need to know you've got the coronavirus and must stay at home. And in fact, as I showed you earlier this week, there is a new test. It's very cheap, very easy. You can do it yourself at home. You just spit on a bit of paper. And it will give you a result not in 1 or 3 or even 9 days, in just 10 to 20 minutes. You can test yourself every day if you want, if you're curious. Now, it's true, it's not as sensitive as the government swab up your nose, but it is sensitive enough to tell you when you are pretty infectious, when it counts, and it will tell you when it counts. Okay, so what have we covered so far? Protect the people in aged care homes in Victoria, fail. Keep people in tight quarantine, fail. Help vulnerable people stay at home, fail again. All the basics, fail. But here now is another fail. It is the Victorian Premier, again today, explaining why people around Geelong are now also banned, like people in Melbourne have been for a week or two, from having visitors. But note a startling admission here about restaurants and about where people are actually most likely to get infected.
That's where the transmission is. It's not in cafes and restaurants, but it is in small numbers in people's homes, one family to another.
Not in restaurants, but in people's homes. But wait, so we closed down restaurants around the country in the first shutdowns, around the country, kept them closed again in Melbourne, put tens and tens of thousands of restaurant staff out of work, and now the Premier tells us restaurants aren't actually a big problem. If you do your social distancing there, you wipe your surface, there are people standing around doing the job, then the risk of restaurants is actually quite low. It's home where you get this virus. This is incredible. This is incredible. This is another sign that our governments everywhere have used crude bans on everything that actually do little good but lots of harm. And as for banning home visits now, do you know why so many people now in Melbourne have broken those bans, why those bans are no longer working well, why the infections keep going up despite Melbourne living under a second regime of stage 4 restrictions. We had stage 3 before, now stage 4, still not working. Do you know why? It is because life for many people, especially young people, is simply not worth living without human contact. Month after month, they will go out, inevitably. Yell at them all you like, set the police onto them, they will go out. Bans will not work, not for long. You look at Melbourne. And lastly, this mask law, now extended to the rest of Victoria, also being contemplated for New South Wales. Be warned.
From midnight Sunday, everyone in regional Victoria, and therefore everyone across the whole state, will have to wear a mask, and I stress, or a face covering whenever they're out of their home.
Brilliant. So now a farmer walking down a lonely country road in country Victoria must wear a mask. A teenager fishing on the banks of the Murray or the Mitchell River must wear a mask. 2 Country Women's Association volunteers having coffee in some desert town must wear a mask. What nonsense is this? The chances of getting the virus out in the open is tiny. The chances of getting it in the open in the country, tinier still. And the masks themselves are of such dubious value that it wasn't long ago that these same officials were warning us, don't wear them.
Wearing masks like that is wasting a mask.
Using a mask incorrectly can actually make it more dangerous.
If you do not have these symptoms, you do not have to wear masks, because there is no evidence that they protect people who are not sick.
And of course, wearing masks can also lead to a false sense of security, not using enough hand hygiene, for instance, and not social distancing. So we don't need it here.
In fact, in the Netherlands this week, the Dutch Minister for Medical Care said from a medical perspective, there is no proven effectiveness of masks. Yes, there is some evidence that they may help, particularly a recent study in The Lancet, but other evidence that they don't help much at all. In fact, only today I read that Victorian paramedics are complaining they've been issued with vented masks that could potentially place patients at risk of catching coronavirus. Please, please, please get serious. We must change. Protect the elderly. Quarantine the sick. do those basic things much better, much tougher. But for the rest of us, yes, social distancing, washing your hands, avoiding packed meetings inside. But the big lockdowns, smashing the economy again and again, statewide face mask rules, huge costs, huge loneliness, huge inconvenience, little gain. Look at Melbourne. People are dying. 13 more just today.